Good day, ma'am. I am Hannah G. Villanueva, a second-year student of AMDNA. So today, I will be performing the wound care. So the first thing that we must do is we need to review the medical orders for dressing change procedure. And then after that, we need to explain the procedure to the client and instruct him or her not to touch the wound area or sterile materials. So, good day, sir.
Good day, nurse.
Kisa yung ngalan kay sir?
Carl Jason L. Villanueva.
Okay, so, okay ra ka, sir?
Okay ra.
Ako day si Hannah Villanueva, sir, ang imong nursing assistant. So, karon sir, limpyuhan nato ang inyong samad, ilisa nato na siya og bag-ong gauze bandage kay para dali siyang maayo. So, hangyo lang nako nimo sir nga dili nimo siya hikapon sa imong kamot ha kay ma-infected man muna siya dugay nung maayo. Yan, hangyo po nako nimo sir nga dili ra ka mag sige o kaning hikap-hikap sa mga limpyo nga butang. Okay lang, sir? Salamat! And then, after that, we need to close the door and then windows. So, after we close the door and the windows, now let's position the patient comfortably. So, okay lang yun yung sir, position, sir?
Okay ra.
Okay lang, sige. So, next is we need to drape the patient using the bath blanket. So, ako ang paano, sir, ha? Mag-drape to, sir, ha? Ayan. Okay, and next, we need to put the waste receptacle over here. So it is reachable now. We place it on the side, and then we need to put apply a face mask and protective eyewear if needed. And then, let's wash our hands or sanitize our hands using alcohol to prevent the spread of microorganisms. So, after, we need to put a clean gloves. So we are done putting the gloves. Now let's remove the tape, bandage, or ties of the patient's wound. So, sir, ako ang paon ni siya, sir, ha? Ay, ako ni siyang ilisan, sir. So, carefully remove the gauze bandage one layer at a time, and then we put it on the waste receptacle. So our waste receptacle is reachable. Sir. So if the dressing is stick into wet to dry dressing, we do not need to moisten it. Instead, we freely remove the ghost bandage. And then, we need to alert the patient. So, sir, medyo sakit-sakit niya. Okay. Sinagsaon lang na po siya, sir. Kira ko, sir. And then, we need to observe the character of the drainage and the wound. Then, we put the soiled dressing into the waste receptacle, and let's remove the gloves and put it on the waste receptacle also. Then, we need to open the sterile tray and put it on the bedside. So this is the sterile tray. And then, let's do the dressing. So first thing that we must do is the dry dressing. So let's open the bottle of solution if ordered, and then let's pour it on the basin. And then, next is we need to put a sterile gloves. Put it on the waste receptacle. Okay, so let's check the wound, like the drains, the drainage, and the integrity of the wound. Okay, and then let's cleanse it using a swab, separate swab. So each stroke, we must use one swab. So we need to clean it from least contaminated area to the most contaminated area. So now let's cleanse the wound from this to this contaminated area to most contaminated area. lang ka, sir.
Okay lang.
Side. Tara, sir. And then, let's put an ointment if ordered. And then next, after we clean the wound, let's apply now the dry sterile dressing. So, kung good nga, sir, ha? Then let's put the second layer. Okay, so now I already put the second layer. Now let's put the woven pad. Then let's take it. Okay na ka, sir?
Okay lang. So, that is how we are going to do the dry dressing.